Good evening, everyone. Thanks so much for being with us. I am Danielle Baslak-Fedig from Meadville Medical Center. We're so happy to have you here this evening, and we're very grateful to have our guest, epidemiologist and Allegheny College professor, Becky Dawson. You have been very busy talking to everybody, so thank you for spending this evening with us.
Thanks for having me.
Before we start, we should tell everybody that we have our wipes with us. We have wiped everything down. We are staying our 6 feet-ish distance apart. Thank you to Jason Sackle, who is here with us for our Friday evening interview. So we want to talk a little bit about COVID-19, but let's first start with what you do. You're the epidemiologist who has been on all the news stations. We're very lucky to have you in Meadville, Pennsylvania, but what does that mean exactly?
So an epidemiologist is actually someone who studies disease transmission. So it's, if you can imagine, the hashtag that came about during the Ebola outbreak was disease detective, trying to figure out who has disease and where it's spreading and how we can stop spread. So it is a quantitative science, so I talk a lot about numbers and data and everything, but really is trying to figure out what is the root cause, how do we stop transmission, how do we kind of track a disease as it, spreads. Right now we're spreading globally, so how fast is it growing and where is it slowing down?
When you started your career, did you ever think that you would be in this situation? Did you know this was coming?
So I think we had all talked about pandemic influenza, and we had that influenza pandemic right in 2009 that, right. It caused some disruption. I think we had always talked about pandemic flu, and then 2011 when Contagion came out, right?
Yeah.
I think that it kind of opened everyone's eyes, both public health-wise and globally, that maybe something could happen. But there have been plans in place for decades, knowing that at some point a new disease would spread, and the fear would be that it would be a respiratory disease that would spread quickly and easily, and in fact, kind of respiratory diseases know no bounds. They just look for lungs. So I think, we've kind of known it was there, but I don't think that we expected it to be this virus spreading this fast all over the globe.
And when this first started, we heard a lot of people, and you still see things on Facebook where people are saying, oh, it's the flu. It's just like the flu, and we don't really need to worry. People die from the flu.
Well, right. People do die from the flu, and actually a lot of people die from the flu. And I think that's worth pausing and noting that just because you've had the flu doesn't mean that you won't get it again or that you won't die from the flu. I think what we need to remember about COVID-19 is that the virus itself is getting deep down into the lower part of our respiratory system. So it actually is, once we get it into our body, it is just kind of like swan diving right into our lungs, and it's finding proteins in our lungs and it's replicating there. And so again, anytime you have virus replicating in your lower respiratory system, infecting your lungs, that's really serious business. So I think we really do need to recognize that this isn't just the flu, and the flu is not just the flu either. So I think we need to really take this seriously and recognize that our lungs are really important to us living every day.
It's been great seeing, we were talking before we went on the air that, comedians and talk show hosts are doing a lot of stuff from home. And so people are taking the social distancing seriously, but there's also, like I said, I saw a picture yesterday of all these kids on the beach still, and the beach is closed. So let's just talk about that, about social distancing. What does that mean, and how is that helping us?
So social distancing is, right now, social distancing is staying at home. I think our definition of social distancing has evolved, right? I think at first it was, let's no more than 250 people. And then it was like, no more than 50. And now it's like, close the schools, no more than 10. I think we went to no more than 5 at one point. Like, we really are saying stay home and stay away from each other. So if you think about, what that does when you stay put, you aren't coming in contact with other people, and the only way for this virus to survive is to jump from one person to another. So if you get it and you recover, but the virus doesn't jump to somebody else, the virus is kind of dead now, right? Like, you're part of the virus. And so we're trying really, really hard to stay away so that the virus can't transmit between individuals.
So we had advertised that we will take questions from any of you, and I forgot to mention that first thing. So if you want to ask any questions and put it in the comment section in this Facebook live feed, we will continue to ask Becky questions. But you bring me to a question that we had emailed to us earlier today. What if your entire family gets it, or what if none of you have it? You're all at home. Do you still need to be washing your hands, wiping things down constantly?
So I think it's, it's a healthy balance, and it's also recognizing, like, are you truly at home all of the time? Have you not gone to the grocery store to get gas in your car? Or I was just saying I picked up work at school today for my kids, right? So I think we need to be really careful with what, just because we're at home more, right? I feel like I haven't left my house.
Right.
It doesn't mean that you're not coming into contact with people, or you're not potentially coming into contact with the virus. So I think, if you are at home and the rest of your family is at home, we should be taking general precautions. We should be washing our hands before we eat, after we go to the bathroom. Like, we should just be washing our hands. I think that as, if you would go out to the grocery store and then come home, you'd want to be washing your hands more in those situations. So I think it is about balance at this point. I know that all of our hands hurt and are cracking. Yes.
And so then you put all this lotion on, and then your fingers feel sticky, and then it feels like, oh my gosh, now everything I'm touching is sticking to my hands.
Exactly. So I think we do need to have some balance, right?
Okay.
Especially if we are abiding by these social distancing rules. Like, if you're really staying home and making one grocery trip a week, and you're keeping your distance from your neighbors, and maybe you're going out for a walk, I think just normal, regular hand washing at home is really important. I think the big thing that we can do is keep our hands away from our faces.
Yeah.
I think for some of us it means pulling our hair back more often, keeping everything away from our face, because that's going to be the easiest way to transmit disease into our body. And that means rubbing our eyes too. I know that it's so hard.
Yeah.
And so really taking the time to remember, if you do need to rub your eyes, if they're itchy, if they hurt, go rinse your hands off really quick, use water. It's 20 seconds to wash your hands, but then be able to itch your eyes or rub your eyes after that.
Well, I can hear more. I mean, we have a lot of singing in our house already, but now my kids are singing and singing and singing. So all those songs are certainly helpful in making, because 20 seconds is a long time.
It is a long time.
I know, I usually do a little wash, and now I'm more conscious of
Absolutely
20
I am
seconds.
Too.
So lots of people, I think, are just scared. They don't want to leave their house. They don't want to have any contact. What can you say? It's a very serious thing, but what can we say to alleviate some of that fear?
So I think I want to acknowledge it is scary, right?
Yeah.
We're dealing with a virus that, if you listen to the best health experts out there, they don't have a lot of answers. How long will this last?
Right.
Will we see it again? Can it reoccur? Is it seasonal? All of those questions, we have some evidence, but we're not ready to make a definitive conclusion. And I think acknowledging that that's really scary for all of us is really important, that there's a lot of unknowns. On the flip side of it, we also know that there are ways to remain healthy, and I think the social distancing is one of them. But as we're social distancing, I think it's also important to remember, like, being healthy at home, drinking lots of water, getting out and getting some exercise. It was beautiful out there for a little while this afternoon.
Right.
So walks can be great. You can't go walk in big groups of people, and I know some of, Woodcock is not open right now. There's places where we can't go. But a walk in the neighborhood, getting your kids outside to just run around, I think is really important. A bike ride around the neighborhood. Again, you want to keep your space and, assuming that you're still healthy. I think, though, that we can take care of ourselves in these moments. So eating well, drinking a lot of water, getting some exercise, sleeping well, or at least trying to sleep well in the midst of this crisis is going to be really important.
Right. So we were talking again before the camera went on. We don't know what to expect. This is uncharted territory. But you said, we can look at China, we can look at Italy, we can look at some of these other places and know what's coming. And there's a lot of value to that.
There's so much value. We are not the guinea pig here, right? The virus didn't jump species and start here. And I think it's really important to acknowledge that this isn't a disease of geography or of a certain group of people. This is a coronavirus that is common all over the world. And it happened to jump species in one location. And what we can do right now is really appreciate that the Chinese are sharing, that they're making data available, that they're actually communicating with people, because if you're watching the news, they actually have very few new cases right now, which to all of us should be somewhat like relieving, right? We might be able to take a breath. And so I think that, we should be really, really appreciative of the public health officials and the medical staff in China right now for sharing and for putting things out there. And I think we can watch as they really put some severe social distancing, lockdown type of social distancing in place. And they're seeing very few, and I don't think there were any cases yesterday diagnosed in Wuhan, which is enormous given where they were. So I think we can take some, a little bit of comfort, but we also know as they start to kind of loosen some of their restraints that we'll have a lot to learn as we watch what happens when they kind of I think they're going to go slowly back into things, which I think is what we should all expect. We're not going to, one day all be able to go back to normal. I think that we're going to have a new normal. So I think paying attention to what's going on there and in Italy and in Europe, I think we can learn a lot. A lot's coming out from Taiwan and Japan. So there's places where we can learn and we can maybe take some of our cues for how long things are going to have to be in this tight social distancing space.
Let's changing gears a little bit. Let's talk about symptoms. Because this time of year, I find myself with a little bit of a tickle, and I think, oh my gosh, is this allergies? How do I know if I should go to, should call the Mevo Medical Center number to go and get evaluated?
Yeah, so that's a tough question because we have a lot going on. We have influenza A, influenza B. It's now seasonal allergies, right? So everyone who has spring allergies, strep throat has been going around pretty. So the sore throat, people with bronchitis and other forms of pneumonia, right? Different viruses causing pneumonia and bacterial pneumonia. So there's a lot of disease circulating. So I think what we all need to think about is, if you need to call a physician, so I think there's multiple reasons for calling a physician. You are so worried that you're not sleeping anymore, right? Like you really are panicked. I think it's worth a phone call, whether it's to the medical centers, like Nurse Line, or whether it's to your primary care physician or the flu clinic, right? We can call all of those lines. If you don't have access to healthcare, the Pennsylvania Department of Health has a 1-800 number, so you can call 1-877-PA-HEALTH. 24/7, a nurse will pick up the line and kind of talk you through it. So free service from the Department of Health, which is great. So I think calling and asking questions is really, really important. Just like with the flu, many of us, when we get influenza, we don't end up in the doctor's office, right? We stay home because we have a fever and we have body aches and we have like some sort of respiratory issue. We can do the same thing with COVID-19. But again, there comes a point when you have flu where things, you need to see a doctor or you want to talk to your doctor. And I think that's where we are with COVID-19 as well. We want to pause and know that for most of us the symptoms might be mild, but there does come a point where respiratory distress, like severe respiratory problems, are one of the symptoms, and we really do want to call a doctor, or if need be call 911 to get in and get someone to treat us.
And we're hearing some cases where people had no symptoms, and I think that's what's scary, is because anyone could be carrying it and you can talk to them. That's why the social distancing is so important.
Really important.
With no symptoms.
Right, so somebody who can be completely asymptomatic, meaning they have no symptoms, no tickle in their throat, no breathing problems, never spike a fever, and they still could have the disease and be spreading it to others. Looks like Jason has a question too.
Yes, Jason.
I do. Actually, Nate Youngblood has a question.
Okay.
And he wanted to know if you could speak a little bit about the length of time that it took for COVID-19 to reach its current status in China and the interventions that were made to reach that point.
Right, it's a great question. So COVID-19 kind of came onto everyone's radar on December 8th. That was when they released that they had some cases of a new novel virus that was spreading. If you read some of the people who've traced it back, they've been able to do some of the genetic work with the virus and have been able to go back into November to see when it happened. So if you think through December 8th was when we saw it, and then late December, early January was when they started, locking down the city, and then, today's the 20th of March, right? So now we're just seeing things. So that's almost a full 3 months of very serious social distancing. So now I think one of the things that we should, is that we've had the opportunity, we in the United States have had the opportunity to learn from them. So we might have put our social distancing we've implemented all these social distancing things maybe a little bit earlier before cases started to really spike. I mean, there's some serious spikes in the United States, but nothing like we've seen in other places. So
Right.
I think we can be hopeful that we're ahead on that curve, but it did take 3 months of isolation and social distancing and, you know, really shutting down cities before people were able to, you know, start thinking about maybe loosening some of the restraints.
And we need to keep up our guard because we're just starting into this. And
We're
so
only a week in.
yeah, if this is gonna last months, we need to all be part of, you know, the greater good.
Exactly.
And for all the medical professionals, the nurses and the physicians, and a long list who are going into the hospitals every day, and so we're helping those people as well.
Absolutely, yes. More questions?
I have a question actually. We talk about flattening the curve.
Yes.
How does our curve differ from what we saw in China and other countries?
That's a good question.
It's a fantastic question. So we have, I mean, you can go look online. People have done it. So if you think about the curve, and I'm trying to think which way, is this the right curve or is this the right curve? Doesn't
Not
matter.
sure.
Like this is the x-axis, this is right, y and
Yeah,
x-axis,
yeah.
right? This would be correct,
Looks right to
right?
me.
So along the x-axis here, you have days, right? And then this is the number of cases that have been diagnosed. So, you know, in Wuhan, it started, you know, in November, and then it spiked up really, really high, and then they maintained this, like it exponentially grew. We're already on an exponential trajectory here in the United States, and I think what's really, really hard is that the number of people there are in the United States and the number of people there are in, you know, Wuhan or Italy or all that, it might not look the same, but I think we need to look at shapes of the curve. I mean, we are already at a place here in the United States where we're seeing exponential growth. So the county executive did an amazing job yesterday in Erie. You know, she said, this is a number we had this time last Friday. This is where we are today on Thursday. And it was a doubling, more than a doubling. So we are seeing a lot of growth. And so I think we're on that same trajectory where the curve is going up this way.
Mhm.
And that really our intention is that as it goes this way, can we just, you know, can it smooth out a little bit as we
Right.
go there? So I think that's what we're aiming for. So our curve is looking similar, but we might have put in the implementation, because even the social distancing that we've been doing this week, we're not going to see an impact of it for another couple of weeks, probably not for 14 days if we're thinking about the incubation
Right.
period. So we have a long time to wait to see some of the impacts, which I think is hard emotionally. I'm staying home. I want to see something happening.
Right.
I want to feel better about it, but I think at least 2 more weeks before we see some impact.
And we were talking about the picture that I saw of these, you know, younger people on the beach. They're all going to go home, and if one of those people, I mean, I think that's a perfect illustration. There's so many good illustrations that I've seen, but you know, if one person is infected, all of those people go, and you know, it spreads, and it spreads to all ages. You know, I think at first we heard a lot of, well, it's just the elderly, but
It's
anybody
not.
can catch this.
Right. Yesterday's report from the Centers for Disease Control and Prevention, actually, if you are a 20 to 40-year-old, should have been one of those oh my gosh moments, because I think that age group we're invincible. Like this
Right.
isn't going to impact us, this isn't going to hurt. But of everyone in the United States, so not looking at the China data or the Italy data or Japan or anything else, but looking here in the United States, it's something like 20% of all hospitalizations are among COVID-19 patients who are 20 to 44. And then the ICU, you know, everyone, you know, who then needs ICU, it's like 12% of those people. So I think if you're young and thought you were invincible, I mean, if you get this, a 1 in 5 chance of having to be hospitalized, that's a risk you don't want to take.
Right.
That's serious disease. And that's, you know, when you need to get to the hospital for respiratory issues, you're in a life or death situation.
Yeah.
And we need to treat it that way.
And again, if any of you have questions out there, go ahead and put it in the comments section. Jason's keeping track of those, and I'm trying to while talking. But if you have any questions, anything you might want to ask Becky, please feel free to ask. We were traveling, this was a week ago, and just watched people going into a gas station with their bare hands, one person after another, after another. What precautions, like how far do we go when we go out? Because, you know, I'm wearing gloves and I'm wiping my credit card after I swipe it. And are those the precautions that we need to take now and for months?
I think, so I do think that this is really handy, right? I do think that there are, like, I mean, touch points that are touched by multiple people, right? So the gas pump is a great example, right?
Yes.
Thank goodness most of our doors at grocery stores are automatic. We're not touching doors to get into those things, but shopping carts would be another like frequently touched point. I mean, Walmart has always had these at the front door, and most of us don't use them. Now is the time to start to use them. And I think too, remembering like anytime you leave your house and then you come back, wash your hands, and then think about the things in your, like where the virus might hang out. So it can live for about 72 hours.
I was going to ask, on different
surfaces.
Okay.
Yes. So Jason is just holding his up, but this thing right here is probably the dirtiest thing in your house. Okay. So what I've been doing is I've been popping my case off and washing it with soap and water every night, and then literally drying the cover in, you know, where I would dry dishes, and then coming and like kind of reassembling my phone in the morning. The other places to think about, door handles. We don't usually clean door handles in our house. It'd be time to clean the door handles.
Okay.
The sinks, I mean, usually when you clean your bathroom, but that's where everyone's touching. The sinks are really common. Door handles. And then for those of us that share a car, right, the steering wheel. I think we do need to think about the steering wheel, door handles to cars, especially because you go from the grocery store into your car, and most of us don't have the opportunity to wash our hands during that moment. So, I mean, you know, it sort of feels like back to basics, right? Like, don't touch your face, wash your hands, think about all these common touch points, and really do a good job of, you know, cleaning a little bit more often, especially as you leave your house. And I think that's the big thing. Most of us are staying home for a lot of it, but trips to the gas station, the grocery store, you know, if you have to go to the bank, I think that it's important to think about what are the extra 5 minutes on each side of the trip that you're going to do to kind of clean up and remove anything that you might have come in contact with.
What about our mail? When we pick up our mail, what do we do?
I think mail's just it's another touch point. I mean, I don't, you know, our postal workers are probably being screened and, you know, being taken care of.
Sure.
So I think, you know, as you get your mail, you go through it, and, you know, the morning, you know, when you get it at lunchtime, now we're all home. We all know our mailman, right? So you bring it in and, you know, you open it, you do whatever you need to do, and then again, wash your hands after that, right? Put it in the recycling, you know, file it, whatever needs to be done, and just, again, thinking about the fact that you just came in contact with someone else. And as we're trying to socially isolate and keep our distance, this is a moment to just say, okay, one more touch point, one more thing that I can do to keep things clean.
It's a lot to think about.
It's a lot to think about. Building in time for hand washing is important.
Yeah. We have a question. How long is the outbreak likely to last? One report has said it may last up to 18 months.
Right. It's a fabulous question. And I think this is one of those things that we don't know.
Right.
So there's so much about the virus that we don't know. I think people are saying, is it seasonal or not? So like the flu drops off as we go to spring, so does a lot of the other common cold type of viruses.
Yeah.
Maybe we can be hopeful that that will happen here, but we really don't know. I think the 18-month thing, what I have heard, the best news I've heard is that 18-month is also the amount of time we will have until we have a vaccine, the shortest amount of time until we have a vaccine. And so I think people are saying, like, until we have a vaccine or this thing burns out by itself, this is going to be part of our new normal. And I think that that's how we need to approach it. I think you know, setting a timer on your phone to say in 18 months, I won't have to worry about this. That's not what that 18 months is saying. It's saying in 18 months we may have a vaccine. In 18 months, some of the clinical trials looking at treatment might be done, and we might have better ways of treating people. In 18 months, this thing might burn itself out. There's just really no way to know. Yes, Jason.
So you mentioned a vaccine and that 18-month trial period.
Mm-hmm.
Is there procedures in place to quicken that period up in the event of a pandemic or a national health crisis?
Right. So the vaccine right now is actually being fast-tracked is the word that we use. Vaccine trials are usually 3 phases, so they're very boring names: phase 1, phase 2, and phase 3. And they're governed by FDA. So phase 1 is all about safety. So if I come and jab you with a vaccine, I don't want you to pass out, have some sort of adverse reaction, or I don't want to give you the disease. So we take a bunch of healthy people and we make sure that the vaccine can actually be used. Phase 2, we look to see, is it effective? Kind of still thinking, and when we say effective, we're trying to figure out okay, what dose do you need so that you don't get immunity today and then it's gone tomorrow? We want your immunity to last over a season. And then we go to phase 3 where we try to figure it all out. We actually give some people the vaccine and other people get something else, standard of care. And we have no standard of care for this right now, so they'll probably get a shot of something, right? We are trying to combine all those things so that it does work a lot faster. So 18 months from my perspective feels so soon. Like it's almost unbelievable that they could actually do 3 phases and go to market in 18 months. It feels rushed. So I think that people need to recognize that that's really unusual, going
and then
18
to mass
months.
produce
And then mass produce. So they're already, as they're doing the trial, the vaccine developers are working on business plans to, get as many vaccines as we would, need globally at this point, which is a huge task. So I think the good news here is that phase 1 trials have begun. So they are already, putting, a shot into people's arms, and they're trying to make sure that this is going to happen. But 18 months is a really quick time to do a vaccine trial.
It really is.
Yeah.
I had heard that when warm weather comes around that things are going to just clear up because of the warm weather, because this disease doesn't survive as well in warm weather.
We don't really know that yet.
Okay.
It's too new. Like that whole novel thing that we've kind of gotten used to saying COVID-19 or the coronavirus. It is a novel coronavirus and we truly don't know. So I think there's a lot of us that are hopeful.
Right.
There's evidence pointing in both directions. And so no one is ready to say that this is just going to kind of peter out when we see the season change. So I think that this is one of those moments where the social distancing needs to be even more important, because we truly don't know at this point in time.
I think people see that word novel in a lot of situations. Do you want to explain what that means, since a lot of people aren't using it in association with the term?
Absolutely. Okay, so coronaviruses are this big family of viruses. We've known about them from the 1960s. So there are 4 common coronaviruses. And they have very, again, kind of boring names like alpha, right? So those common coronaviruses are the ones that cause the common cold. So if you get a coronavirus, what's the distinguishing characteristic between what the thing is that they share is that they're going to replicate in your upper respiratory system.
Okay.
So when you get a common cold, your eyes run and your nose hurts and your face hurts. That's because the virus is actually replicating in the upper part of your respiratory system, throat and up. The novel coronaviruses, and there are 3, are SARS, which was 2002-2003, so severe acute respiratory system, MERS, which is the Middle East respiratory system, and then what we have now, COVID-19. So they're novel in that they are unique, and they also share one thing in common, and that is that they replicate in the lower respiratory system. So genetically, they're different viruses. They look different. They've actually come from different species. They are very unique, but the novelness of them is that they are new and they do replicate in the lower respiratory system. And that's what makes this so dangerous compared to the common cold, because I've heard so many people say this is just the common cold.
Right.
And it is the same family of viruses, so in some ways there is some truth to that statement, but the manifestation of the disease and where it's going to impact you and how severe it is, this novel virus, which is new and unique, will replicate in your lower respiratory system, which means your lungs are in danger of being really, really hurt through the development of the disease and as the virus is replicating.
A question from earlier today: what if I see my coworker coughing? What do I do?
So,
I mean, probably now there aren't a whole lot of coworkers working in close proximity, but I guess the question remains: what do you do if there's a cough that's coming next to you?
Right. So I think we all need to be at a place where we talk to the people around me to cough into their elbow. Better yet, if you can get a tissue and cough into a tissue and then throw that tissue away, then you have to wash your hands again. I recognize that. So I think that's really important. There's a lot of places, and I would encourage businesses and things that are staying open to screen workers. I mean, yesterday when I was at the Erie News, before I walked in, do you have a fever? Do you have a cough? I mean, really went down a litany of things before they let me in the door, and I really appreciated their attention to all of the details, whether it be flu or strep throat or COVID-19. They didn't want anyone coming in, even though there was a skeleton staff and lot of space between us.
Yeah.
They really wanted to make sure everyone who came in was healthy. I mean, we cough sometimes because we have a tickle in our throat, or we drink water and it,
Right.
goes the wrong way. So I think, not doing anything. And I think there's, room here to, not assume if you cough right now that you have COVID-19 and you are infecting me and you are to blame. I think we can say, talk to each other about, good hygiene. Do you need something? Should you be going home from work or something like that? But placing blame on people for this is not the answer. I think we need to come together in this moment, not shun, blame, point fingers at anyone, that they're the person causing this disease.
It's been really, a great thing to see the communities coming together in interesting ways. Of my kids are on a soccer team, and so they're texting each other pictures of here, let's do this skill today. And so I think this is going to be really helpful as we continue to still socialize with people. We just have to do it in a different way than we've ever done before.
Absolutely. I mean, I know that there's streets that are doing kids art in the window, so like an art show walking down the street, right? People are talking about putting their Christmas lights back up again, right? Like, I mean, what are things that we can do to kind of show each other that we're thinking about each other? And I think it's really important that we check in on others too.
Yeah.
I think, as we've gone to this place where some people are quarantined, some people are self-isolating either to protect themselves or, because they actually are ill with some sort of disease. We still don't have COVID-19 in Crawford County. And it's very important to set that record straight. Have not had a diagnosed case.
And they have tested people.
Right.
So it's not that we don't have the test.
Exactly. That's really important.
Question.
Yes. So I think that it is really important to know that we're just going to have to come up with new normal and, checking in and, being supportive of each other and, recognizing maybe who are the two highest at-risk people in your inner circle and either checking in on them or helping them out with, whether they need groceries or, errands run or something will be really important in this moment.
And as parents, what do we say to our kids who are hearing all this scary stuff? How do you explain it? What advice can you give to parents out there?
Oh, okay. So what we've been doing is using this as a great lesson in math, science, and like global geography lessons, right? Is that, we're dealing with a virus that is an RNA virus. So it's going to jump from species to species. So it allows you to talk about jumping from bats to humans and camels to humans. It's part of our world. This virus it's there. And the unique aspect of this time is it has come, into humans for the first time. It used to be in bats and now it's in us, and kind of we're all connected, right? That this isn't just about, blaming the bat, right? But we live in a world where bats are part of our lives. They're in our backyards here. So I think that's where we start, right? That this is another disease and it's part of this family of diseases, is these viruses. I think we can help them understand, what we mean by exponential growth, that like, if I have it, I'm likely to give it to at least 2 more people. And if they have it, they're likely to give it to 2 more people. And, you can see the number, like the math tree moving on there, how many people would have it. And then I think to, start having the conversation, what does it mean to flatten the curve? Who are we trying to protect here? Why is it that you can't go to school? And, what kind of practices are we taking as a family so that we can make sure that people that we love that might be at greater risk are actually protected from, some really serious adverse effects? I think being okay with talking about the hard words, pandemic is for me, it's a scary word, right? And so to understand that there is globally more cases of this disease than we would ever have expected. And that it is new, and every day we're learning something new about it. And I think that if you have kids, that's a great moment for teaching, right? Today we don't know, but tomorrow we're gonna know a little bit more. And then we're gonna know a little bit more the day after that, and we're gonna know a little bit more the day after that. So I think it's a moment to pause, and we've talked about, what are you afraid of? Who are you afraid for? What is hard about being in our house all the time? We've had those conversations. How are you going to do school, like in this space? And so I think having those conversations and acknowledging that it's scary for all of us. I don't think if anyone, it should be scary for all of us. We should be worried in some way, and nothing else worried. How are we going to get back to normal? And I think having those conversations with our kids are really important.
And again, if anyone out there has questions, you can put them in the comments section. We welcome any questions for Becky. So as far as like going to the grocery store, you know, we see people going in and, you know, stockpiling. The grocery stores will remain open. Be smart. And even in Italy, where people are quarantined, they can still get out to the grocery stores. So, you know, what advice do you have to people out there who might be worried about that in particular?
So the grocery stores don't seem to be shutting down. I think they're doing a great job of saying we're going to be open shorter hours to restock and to clean. And so every time we walk into the grocery store, I think we should be really grateful for those moments that they actually are restocking and that they're taking time to clean. It sounds like, you know, we can still get the supplies that we need. I think what we do need to realize is if somebody in your house does become ill, so with whatever disease, they're not going to be able to go out during those times. And so you want to have enough supplies that, you know, if somebody does become ill in your house, you can stay home and take care of them. But, you know, for most viruses, it might be 5, 7, 10 days. We don't need 3 months worth of toilet paper or, you know, anything like that. So I think being, don't be, you know, I don't think we're operating in business as usual, and I think it's okay to acknowledge that, but I don't think we need to hoard and think that we're not going to be able to get toilet paper for the next 6 months of our lives. I think we will be able to get toilet paper, and, you know, I think we need to stock the shelves and, you know, allow kind of like the craziness of last weekend to like get over that hump, but I think we'll be okay. So I think knowing that you can go to the grocery stores and that they're doing a good job of cleaning is really helpful.
Yeah, it is. It's just a new normal.
It
and
is.
Our everyday with our working at home, having our kids at home, we all need to cut ourselves some slack and realize, you know, every day is just going to be new over these coming
and
months.
There's so much emotion going in with all of this, right? So like I was saying earlier, like I was so rational about this, like this is what we need to do. I understand the curve, like, and then all of a sudden the sadness of the college canceling graduation and all the students needing to go home and no classes for the rest of the year in person, that we're going to online learning, and then the public schools being canceled. Those are, I mean, that's never happened in any of our lifetimes, right? Like that, like this is enormous. And I think pausing and talking through that and maybe feeling all those feels right now midst, it's okay, right? I think that what we need to know is that the public health authorities, so at least here in Pennsylvania, you know, our Secretary of Health, along with the governor and their staffs, they're really doing everything in our best interests, right? They don't want to get to crisis mode here. They want to slow the growth. They want the hospitals to remain, you know, completely able to serve the patients that are coming in through the doors. And so I think trusting that they have our best interests at heart and following their orders, which is stay at home right now. But then being okay with this is going to be hard and it's going to be new and there are going to be real inconveniences and some sadness as well.
In the comments, Teresa asked, how prepared are rural areas in PA, and can we count on help from the major urban area hospitals, you know, when it hits rural PA if we need it?
Right. And so I think that, you know, all of the rural hospitals, actually all of the hospitals together, we have preparedness plans. They have dated back to, I mean, preparedness planning, like public health preparedness really became a thing after 9/11. After anthrax, when there was fears of smallpox, and the state and local health department, along with the federal government and all the health agencies there, along with, you know, the hospitals, really came together and did a lot of preparedness. So there are plans, there are contingency plans. I know if you listen to the HAMT and which is the AHN and UPMC people, they actually are talking about how they have plans to share and that share goes both ways, right? That there are places that way. And there also, to make people feel better, there is a strategic national stockpile. We have stockpiled in bunkers, undisclosed. I don't know where they are. There are probably a very short list of people, but there are ventilators there are supplies, there are additional drugs, vaccines. We've been planning for, and not knowing what not knowing what the disease or the impact would be, but planning for that as an entire nation for years and years and years. So a lot of thought has gone into this, and so hospitals health departments, they're drilling, they're practicing, they're thinking things through. So again, I think that it doesn't mean that things might not get tight, right? It doesn't mean that, but everyone has thought through like, what is the worst case scenario we could imagine and how would we move in that moment?
I think it's also worth noting that we have Dr. Carol Encarnacion, who's an infectious disease physician. A lot of community hospitals don't have a dedicated infectious disease physician, so it's amazing for us.
Absolutely.
And we should be very proud to have her here on the front lines helping to take care of our patients.
Absolutely.
So, do you have a question?
Nate had another question.
Okay,
go
Nate.
for it, Nate.
He said that if someone contracts the virus and they had to go ahead and completely quarantine for the 14 days, are there any services one may use to get the necessities? And we may not know those answers, but I'm sure there are things being worked on maybe.
Right, so I'm thinking like if I was living by myself and needed service, right, if I was told to quarantine. So I think there's a couple of things. One, if you do have a test, so if you do get a COVID-19 test, if I learned anything yesterday from the Erie Department of Health, that just having the test is supposed to be reported to the Department of Health, and you are supposed to quarantine until the test results get back.
Okay.
So if you are going home by yourself, I think that that's a conversation you need to have with the practitioners who are giving you the test and the health department that is recording that you are one of the people that is having the test.
That's really important.
Right?
Yeah.
So I think that we have that responsibility to remind whoever is giving us the
Okay.
test, regardless of who it is, that it does need to be logged with the State Department of Health, that it does need to be reported, and that's the moment to ask for, I'm going home by myself, can somebody bring, is there a way to get food? Is there a way to, ensure those things? And I think that we should be asking those questions. If you are going home to a family, you need to just stay as far away from possible. And I know some of our living situations do not provide tons of space, but you need to create space. And remember, it's a 6-foot distance, right? So it might be, duct taping a space on the floor and saying we don't come, in contact with each other, but you do need to go home and stay away from people.
I have a question here from Mike. Should we only be using paper towels to dry hands?
So that's a great question. At this point in time, there's no evidence, like does it live on towels, does it, all of those things. If you're doing proper hand washing and you're then wiping your hand on a towel in your bathroom or in your kitchen, you should have washed off all of the germs and that towel should be okay. Should we be more diligent about washing the towels more than we do normally? Absolutely. If someone in our house is sick, common cold, influenza, strep throat, whatever, I think we should absolutely think about going to disposables. I mean, even thinking about disposable plates and silverware, if somebody is really ill, could be a really good idea, because a spoon and a mouth, right? Like, it's just a bad idea. So again, if everyone in your household is healthy, I would think, if everyone's washing their hands properly and really socially distancing themselves, you can still use your towels. But
Okay.
as soon as, you start to suspect somebody with any sort of illness, I would switch to paper towels just to be on the safe side.
And when you are washing, it does come out just with soap and water. You don't have to bleach every load that's going
No,
through.
you can just use soap and water, just like the 20 seconds on your hand, just a normal load of laundry. Hot water will help a little bit, but you should just, I think the consistency of keeping things clean.
And then he also asked, is when we're touching, we might have it on our hands, we touch, like when you're out in public where you would, be careful to turn it off. So he's asking, should we be that careful at home as well, using that paper towel to maybe turn off the water too?
Right.
Or is that over the top is what he's asking?
So I think the answer is the same. If someone in your house is ill, I think that we should all, I think this goes back to like just basic, disease prevention. You don't want to all in your family come down with influenza or even a nasty head cold. When everyone's miserable, it's a bad situation.
Right.
So I think in your house, if everyone's healthy and you're just taking all the normal precautions and washing your hands, I think you can kind of continue business as usual, but you're going to want to clean your bathroom probably more often than you do normally, or wipe it down at night. It's a simple wipe before everyone goes to bed. Out in public, if you can avoid public restrooms right now, this would be the moment to avoid public restrooms. I know sometimes you can't help it and you need to use the restroom at, the Aldi. But I do think that's the place where you want to leave the water running, get the paper towel, shut the water off, continue to hold the paper towel, open the door, and then throw it away. Because those are really common touch points that have been touched by a lot of people who you don't have control over how healthy they are or what their hygiene habits are.
This leads well into the next question. Do we need to use any special type of soap? So does it need to be antibacterial soap?
No, this is a virus. So don't spring for the, crazy stuff. Really warm water, 20 seconds, and soap is all you need. I mean, it's super, that and all of like how complex this has gotten, that basic just soap. So whether bar soap, whether liquid soap, whether foam soap, it doesn't matter, right? We're trying to wash our hands. I think bar soap right now, again, just how people are touching it and everything, I think you're going to be better with a liquid soap at this point in time. Again, just thinking touch points and everything. But really, it is any type of soap and some warm water and happy birthday twice. Or another song. I would take recommendations.
Lots of lists out there.
Right.
Yeah, there's so many fun ones.
I know.
Any other questions, Jason?
We do have a couple. This young man, he goes by the name of Robert Andrews on, I think you may know him.
Yeah.
You already answered the one. I think that should families make plans now to quarantine within their own homes to prevent further infection among their immediate family?
Yeah, I mean, I think yes. And I think the big thing, at least in our family, what we've done is we've talked about it. What would it look like? Because quarantine is like living in a different room or off in a corner of, the living room and being very thoughtful about not coming in contact with each other. And that's a huge adjustment, whether it's any member of the family having to be in that space. So we've actually talked about what it would look like, how we would communicate, what meals would look like. I think thinking through like that, it means that we don't all sit down at the dinner table together, and that, I might not be able to come and tuck you in at bedtime, and FaceTime between the wall is going to become a real thing, or across a room. So I think, plans are helpful, right? Like how would you use your space? And we all have different spaces. But I think the reality of what quarantine means in a room by yourself, trying not to be in a bathroom with somebody else, like sharing a bathroom, I think just more for me, emotionally preparing and preparing everyone in your family for what that might look like is probably more important than like having the space ready. Because that would be a huge adjustment for any of us to have a loved one be in quarantine for 14 days.
Well, it makes sense. If there's a fire you talk about with your kids, what are you going to do? And so it hasn't occurred to me. So I guess when I
this
go
is a
home
fire
and
drill. I mean, really, we're kind of in the middle of the fire right now, but there still is like this drilling and these conversations and like kind of family issues like, well, what room would we use, or what part of the house, or whatever. But I think the bigger issue is like, what would this really look like if I were in a room for 14 days and I can't eat with you, and I can't, read a book with you, and I can't sit and watch television with you. I think those are really important conversations to have now, and hopefully we will never have to use them. Hopefully the social isolation and will remain kind of a healthy community. But I think having those conversations, right? We have fire drills, hoping that we'll never have a fire in our house. So it's really important to do.
His second question was about the value of unconfirmed people wearing masks.
Great question. So masks need to be used by our health professionals only, period. Now, they might ask you to wear a mask when you come into a building and are showing symptoms of illness. Please listen to your health professional and put on the mask as requested. We should never use masks on our own. And there is one amazing reason why not to use a mask, because every time you put it across your face and you wrap it around your ears and then you try to take it off and then you reuse it, and your likelihood of touching something and touching your face and actually coming into contact with the virus increases so much more when you wear a mask. So number one, it doesn't prevent the virus from getting into your system, and the likelihood that you would touch your face more while wearing a mask is astronomical. So there's like the supply issue, don't buy them, the hospitals need them and the doctor's offices need them, but your likelihood of actually making yourself sick wearing a mask is really, really high. And yes, so just please don't wear a mask unless you yourself have been told by a clinician that you need to put a mask on and there's somebody there to help you. But just using a mask is actually a really, really dangerous and risky behavior at this point in time.
Great advice. Any other questions?
Nope, no, it's not.
Well, thanks so much for
You're
being
so
here.
welcome.
Any final words? We have 10 minutes till our concert series begins, and we can give everyone a break before that happens. But any final words or advice to the viewers out there?
So I think number one piece of advice is find good sources of information. Before we were starting here, we were talking about all the crazy that is on the internet, and I think it's really, really important that we take the time to find good sources of information. So CDC, the Centers for Disease Control, is a great source of information. The Pennsylvania Department of Health is a great source of information. If you need a non-governmental source of information for whatever reason, there are two places that you should go. The Johns Hopkins Center for Public Health Security and the University of Minnesota has a Center for Infectious Diseases. Those two, I mean, actually the map that everyone has seen, right? The map with the red dots and like all the counts, that's from Johns Hopkins Center for Public Health Security. They are doing amazing evidence-based research. They have everyone on staff from ethicists to physicians, epidemiologists to, you know, the people that can make that amazing dashboard. So Johns Hopkins is a great source of information, and as I said, really good news and thoughtful work is coming from the Center for Infectious Diseases at the University of Minnesota. So find good information, stay home. I know it's super hard, and the new normal is going to be really, really hard, but stay home, try to, you know, figure out, you know, what's happening. And I think the third to think about is if you do get sick, this is a respiratory disease, so is influenza. Don't go marching into a clinic demanding to be seen. Don't go marching into your physician's office or the ER at the hospital. This is a moment where, unless it truly is life-threatening, you need to call. Because we need to be triaged, we need to let people know that we're coming, we need to protect our healthcare workers, right? As soon as we walk in, we infect everyone in that office, in that waiting room, whatever. So please, please, please find the phone numbers, whether it be for your physician's office. The medical center has done an amazing job with nurse triage, with the flu clinic. I think that's great. If you don't have a primary care physician or you don't have health insurance, 1-877-PA-HEALTH is really important. They will help you get the services. They can also help you navigate if you do need to get into a physician's office or the ER or the flu clinic. They can be really good about that. So please, you know, call first. Get good information. Don't spread bad information, right? Like it's not helpful. And I think there's a lot of people who are doing some really positive things online. I know there's one that we've been following, like, you know, what are you grateful for today? Who are you checking in on today? You know, what creative space, you know, are you having today? Did you get outside? Did you move? I think just, you know, realizing that this new normal is going to be our new normal for a while. Being okay with that, talking it through, you know, if you need to be, you know, sad about things or angry, that's okay. But recognizing that the public health authorities really are doing what is necessary to control the spread of this new novel disease.
Thank you
You're
so
welcome.
much. We're so lucky to have you in Meadville, and hopefully we'll
Glad to be here.
continue to have Becky here and ask questions as our normal changes from month to month and day to day. So thank you so much for being here. And for all the rest of you, at 7 o'clock, Chase Up Church. So Meadville Medical Center Foundation on our Facebook page every night for at least the next week is going to have different musicians who are not able to perform for their public are going to perform on Facebook Live. So please tune in at 7 o'clock. We have someone tomorrow at noon and 7. You can go onto the Facebook page. There's a full list there. So please join us for that. Stay healthy, wash your hands, and we'll see you next time.